Hi, I'm Emily.
And I'm Olivia.
And today we're going to be talking to you about the importance of understanding head and neck injuries in the EMS world. First, what is a head injury? A head injury is any trauma to the scalp, skull, or brain.
There are two types of head injuries, an open injury and a closed injury. A closed injury is when there's a hard blow to the head by an object, but the object does not crack the skull.
And an open head injury is when the object does crack the skull and enter the brain. Next, what is a neck injury? A neck injury is when any part of your neck, the muscles, bones, joints, tendons, ligaments, or nerves, can cause neck problems.
If you think your patient has a neck injury, always treat them as if they do, whether you're sure or not.
Because if they do have a neck injury and you move their neck, you could cause serious further damage or it could become fatal for the patient. Now let's discuss the common causes of head and neck injuries. These include motor vehicle crashes, falls from a height of more than a few feet, diving emergencies that impact the head or neck, skiing and other sports injuries, and any forceful blow to the head, neck, or back.
Now that you know what can cause a head or neck injury, it's always important to remember that if you walk into a scene and you clear the scene and getting ready to act and your person is unconscious and unalert, call 911 immediately and start your CPR process.
You should always suspect a head or neck injury if the patient has these risk factors. If the patient is 65 years or older, if a child that is older than 2 years old has head or neck trauma, if there is a motor vehicle or bicycle crash involving the driver, pedestrian, or a passenger, or if the patient falls more than their standing height.
Other risk factors include if the patient feels any tingling in their hands or their feet, and any pain in their neck and their back, if the patient is unalert and intoxicated, and if the patient has any specific injuries to the neck or back.
Signs and symptoms include lump or deformity in the head, neck, or back, changing levels of responsiveness, drowsiness, or confusion, dizziness, unequal pupils, headache, clear or bloody fluid from the nose or ears, stiff neck, inability to move any body part, and tingling, numbness, or lack of feeling in feet or hands.
Right. Sometimes your patient might be vomiting. If this is the case, move their head, neck, and body as one unit onto his or her side. This is an effective way to stop them from choking if they're throwing up. First, move the arms up to help stabilize the head and the neck. Grab here and here, and move them all at once. This is an effective way to get her into a recovery position.
If your patient is experiencing any of these signs or symptoms that we've explained, you need to call 911 immediately. Keep these things in mind when assessing the patient: the cause of the injuries, observations of bystanders at the scene who saw the injury occur, immediately apparent injuries and wounds, but do not take the time to do a physical examination if the patient is not breathing, and any observed sign of head or neck injury. If your patient is conscious, you can use these 8 neurotests to assess their head and neck injuries. First, you want to check their head to see if there's any abnormalities, pain, or swelling. Just do light touching to feel around their head. And then you want to do the same for the neck. Then, you want to move down to their feet and touch their toes and ask them if they can feel both toes. Can you feel that? Then, ask them to point their toes. Can you point your toes for me? And down? Then you want to ask them to push against your hands with their feet. Good. Then, you want to touch their fingers and ask them if they can feel. Can you feel that? Same on both sides? And then you want to ask them to make a fist for you and put it towards the ground. Can you make a fist and point it towards the ground for me? Lastly, you want to ask them to squeeze their hands. Can you squeeze your hands for me? Thank you. And that is how you assess a patient if they are conscious. A few of the things we've discussed in a short period of time is the definition of head and neck injuries,
The difference between an open head injury and a closed head injury,
some of the causes and risk factors for a head injury and neck injury,
signs, symptoms, and how to diagnose a head or neck injury,
and how to effectively roll a patient without disturbing his or her neck,
as well as how to assess both a conscious and unconscious patient.
Thank you for watching.